We see so many patients in our practices who have traction that started when they were children,
Yes, tight hairstyle.
especially all of this around the front.
Yes.
And is there any advances that might help those patients? And can they be transplanted?
Well, what I would say with traction, obviously prevention is key, like everything in
Right.
medicine, but this is one of the diseases where if a mom comes in and I notice that her daughter's hairstyle is a
Yeah.
little bit tight, or anyone, if it's mom or adult, every time I'm seeing my patient for something else, but I notice really tight braids, I'll say and it's a little bit touchy to
Sure.
comment on people's hair. But what I say is, I'll say, oh, your hair looks a little tight. You have to be careful because you can lose your edges. And so, and sometimes patients will say to me, oh, it doesn't feel tight. It really doesn't feel tight. And sometimes we'll say, oh yeah, it was very, very tight. I couldn't sleep for 2 days. And I say, don't go back to that stylist, or, or tell her to do it looser, because you will eventually lose your edges. So you can volunteer in a very culturally appropriate way. But the way I say it is, it looks a little tight, very gentle.
Trying to soft pedal it.
Yeah. And, you have to be careful because long-term you can lose your edges. And the key is prevention. When it comes to what's new, obviously we have so many things in the hair space. It's a lot of new things that are coming out. But traction is tough because long-standing traction becomes permanent. So for my patients who I catch it early, I'll do topical minoxidil. I might recommend a hair supplement because I think that can just improve the overall hair health. They could do red light therapy. They could do PRP. That's becoming very popular in that population. And then long-term, if it's long-standing traction, there are hair transplants that are very, very successful,
Mm-hmm.
but obviously we want to avoid the patient getting to that point.
Yeah, of course. Where are we at with CCCA?
CCCA is interesting. I love that there's always new research coming out in that area. A lot of the new research in CCCA is more basic science. So some data that has been published in the last several years shows or suggests that it's autosomal dominant. There's some data looking at the key genes that are involved and so forth. When it comes to treatment, although we have lots of treatments, I still think it is a little bit of a challenge in your dermatology practice. That being said, patients can regrow hair. So one big take home is whenever a dermatologist sees someone with CCCA, don't say it'll never grow back, because if it's in the early stages, it absolutely can grow back. And I tell my patients around 10 to 30% regrowth, and sometimes even more than that. So I don't want you to set unrealistic expectations, but I don't like when patients say, I was told it will never grow back, because what I personally use, I use a lot of topical steroids, a lot of intralesional steroids. You can use, there's some newer treatments like topical metformin was reported.
I saw that.
Obviously, we can use minoxidil. There are a lot of new treatments that are coming out, and we do see regrowth. We don't want to say, oh, 100% of your hair will grow back and it'll come back to normal. But don't say
don't
there's
take
no
away all hope
and send them away. And the other thing, another key clinical pearl, breakage on the crown of the scalp is early CCCA in these patients. So if a patient says they have this good hair density, but they say they're having breakage, pay attention to that patient, because that early intervention can stop this process completely with a topical steroid or an anti-inflammatory.
That's a great pearl.
Yes.
That's a great pearl.